I was diagnosed with emphysema, COPD, probably about 20 years ago now, so I've suffered for a long time. I have endobronchial valves in my left lung to shut the lung down as much as possible, and the right lung is virtually useless now. But I still keep going. And to pay back for things that the British Lung Foundation have done, they approached me and asked me would I set up a new group for their Breathe Easy network. And I run chairman of Breathe Easy Sefton North, which meets in Formby. It's a self-help group for people suffering with any form of lung disease and their carers and friends. With the Breathe Easy group, we have a guest speaker at each meeting, and I approached Debbie Parkinson to ask if she'd be a guest speaker to talk about the Innovation Agency, and she came and talked to us. And as is Debbie's wont, she recruited me for a new group she was trying to set up, the PIES group, and that's the Patient Involvement and Engagement Senate. I went along to the first meeting, and I've been to all the meetings of that group. That group is the patient perspective. It's important because innovation is about technology, data, knowledge, and it's a technical issue. But without the patient, which is what we're trying to help, we're trying to help the patient, without their interface, without their involvement and knowledge, it gets lost. So it's important that people actually involve themselves in initiatives such as the Innovation Agency. Data sharing is vitally important. Different agencies need to have access to a patient's data to provide a linked-up service. The ambulance service calling to a patient should have information on the background of the patient's illness. Very often the patient can be so poorly that they can't give the information to the ambulanceman when they arrive. And if they can share the data that's there on the GP and hospital records, it will be a seamless operation. So data sharing is important. I still think that the man in the street doesn't actually understand what's happening with his data. He doesn't even know whether he's opted in or opted out of data sharing. And we need still to do a lot of work with the public to convince them that this is the way forward. And it's not for sale to chemical companies to make a great profit. It's not for things like that. And we need to boost confidence. I'd say to anybody, the way forward really is to give your consent to have your data shared. You need to be confident that the data will be used effectively. Its storage will be managed correctly. People won't be able to access it willy-nilly. And you really should allow your personal data to be accessed by all medical professions, even down to the stage of a care home being able to share your data so that they can provide a better service of care. Ultimately, shared data is important. It's important for the medical profession. It's important for the patient, and ultimately, shared data saves lives.